Okay, good morning, good afternoon, and good evening, wherever you're joining us from. My name's Lewis Temple. I'm the CEO at BRAC UK, and you're very, very welcome. I'm speaking to you from a very sunny London, and very, very much looking forward to this webinar today. Please note that this webinar is being recorded for the purposes of sending it to you afterwards, and also sharing it with other people who are not able to join us today. For example, people in North America who the time zone is not very conducive to watching a webinar this morning. I'm really pleased to be joining you this morning. We've got a very dynamic group of panelists to talk to you about assessments that BRAC has been doing over the last few months to really understand the impact of the COVID crisis on the most vulnerable in the countries where BRAC International in particular works. These assessments have been done really to inform the priorities of BRAC for its own response to the COVID. And we've done these assessments. We're now on the 4th round of assessments to ensure that we undertake them very regularly to understand the changing in the situation for the most vulnerable people who we are there to serve. And today we're going to hear and learn about some of the key findings from these assessments, and particularly the 4th round of the assessment, which with data that was collected in mid-July. And I'm very pleased to be joined by 4 of my colleagues from BRAC. Firstly, Kazi Eliza, who's the Associate Director for Monitoring and Program Quality at BRAC International. Dr. Munshi Sulaiman, who's the Regional Research Lead in Africa for BRAC International. Ruth Okowa, who's our Regional Director for BRAC International for Africa. And Sajedul Hasan, who's the Director of Humanitarian Programs and also the Interim Regional Director for Asia. I'm now going to quickly hand over to Munshi, who's going to introduce us to the methodology used during the assessment, and particularly the approach in this very challenging environment of the lockdown situation during the COVID pandemic. So over to you, Munshi, and thank you very much. Looking forward to a quick overview of the methodology. Thank you.
Thank you, Luis. So as Luis said, I won't sort of repeat the background of it and straight jump into the details that I think we should be aware of in interpreting the findings, more specifically the sort of limitations, so that we know what this data tells us and what we should not be sort of extrapolating from the data with regards to sort of making conjectures about the country level context. So as Luis said, we have done 4 rounds of assessment so far. Round 1 was very early on in April, the data collection. So the dates are basically the dates when the data collection took place. So it was over 2 days in April. The 2nd round was mid-April, over a week. The 3rd round in June, and the last one in July. So from the intervals, as you can guess, another round is knocking on our door. So the team is sort of preparing for that in early September. Secondly, who are the participants in these phone interviews that you have done? As many other assessments that have sort of faced the same constraints that we did, we went with the people for whom we have contact information. It was done as phone interviews for very practical reasons. That was the sort of sensible thing, and sort of not risk our respondents by trying to do in-person interviews. So when we went with our beneficiary and volunteers for whom we have contact information, and the interviews were done over phone. And as in any phone interviews, typically we get about sort of 50% sort of response rate. We had sort of similar response rates across the 4 rounds. So this is just to say that although we try to make it as broad as possible in terms of the available contact, the information comes from beneficiaries and volunteers that BRAC works with. On the survey instrument, it was, again, for practical reasons, was kept short, within sort of 5 minutes of interview, especially in the early on when we didn't know how the response rate would be and we didn't have as many contact information. We had even shorter, but over time we have been able to add more questions and sort of look at certain things more periodically. So things like gender-based violence or schooling related issues, those were questions were added on those aspects later on. Finally, just to quick sort of flavor of the type of respondents that we have. It's primarily female-headed households that mostly reflect BRAC's priority of the type of households we work with, both as beneficiary and volunteers. So 70% of them are female-headed, which is not necessarily sort of nationally representative as such. Secondly, it's a sort of equally distributed between rural and urban. So it's in some rounds it's a little bit less than 50% in rural, so it sort of ranges from 40 to 50%. That again sort of reflects a little bit of BRAC's area of operations. To move on to this next slide, just to give a sense of the number of participants that we have from different rounds, I put it on a map that shows the number of cases in the last 2 weeks. I just downloaded yesterday from, I think, New York Times. It shows in the last 2 weeks number of cases and sort of just to remember that it's in the context of the COVID, and the countries that we are working with are mostly in the zone of sort of moderate number of cases per capita. There are sort of, as you are very aware, there are various issues behind it. For example, Tanzania may not have as many tests per capita as it is happening in Uganda, for example. But most of the countries are sort of in the intermediary zones. And the number of respondents per round, if you aggregate it, you'll see we started with about 1,000 in the first round, but then it went up to, by the time we went to round 3 and 4. In terms of representativeness of the beneficiary, considering the sort of the population that we are drawing from, it gives a sort of reasonable margin of error around less than 5% with almost 400 respondents in most countries, but Philippines and Nepal, we have fewer respondents, which also reflects our depth of programming there. So I won't sort of mention the specific numbers, but just to highlight that these changes. Then I'll just quickly on over 2 slides, I'll give a bit of background of the type of respondents on the characteristics that seem to be relevant on the level of impact they have faced of COVID and COVID-related lockdowns. So one is the type of income source they have. So whether it's business is the main source of income, salaried work, casual labor, or agricultural livestock. As you will see, I will not give away too much of what Eliza is going to present anyway, but people who have salaried work have been affected less than people who rely on casual or day labor. And as you can see, there are sort of big differences across countries, but overall, about 50% of the respondents have business as their main source of income, which also kind of reflects BRAC's program through microfinance, who are micro entrepreneurs and have their micro enterprises. In Afghanistan, there is a lot of salaried work, which is primarily because of the education projects that cover salaries of teachers and associated community level workers. Quickly to the next slide on how they maintain their food sources, whether it's primarily based on own production, purchase, or a mix of both and other. Again, as you can see, it's mainly purchase, since, as I said, over half of them are in urban areas. It's not surprised that they rely on purchasing their food or the major food items. That has two relevance. One is the accessibility, especially depending on the level of transport restrictions. And the second is the price effect, especially between rural and urban areas. Otherwise, own production is a little bit higher in areas where we have agricultural livestock as the main source of income. So just to mention Philippines and Uganda. So these are kind of the respondents that we looked at, not exactly national representative, but I think this gives a fair bit of idea of a good number of people, because collectively BRAC is reaching over millions of households. So the samples are representative of them. Over to you, Luis.
Thank you very much, Munshi Bai. A very rigorous approach that's been used there and impressive given the circumstances. Just to let you know, or any participants have any questions or comments, please use the chat box. And I think that we should be able to see questions coming up, and we'll have an opportunity for the panelists to address those questions at the end. I'm now going to hand over to Eliza to really discuss with you the findings of the assessments, and to talk those through with you. Over to you, Eliza. You're just on mute there, Eliza.
Yeah, sorry. Yeah, thank you, Luis, and thank you, Munshi Bhai, for giving an overview of the methodology. So I'm, in the interest of time, I'm jumping directly into the results section. And as Luis already described briefly, that the main purpose of this assessment was to really see the impact of COVID-19 on income and food security status, particularly on BRAC program participants. So my first set of slides is focusing on the impact of COVID on income. As you can see from this slide, we tried to capture income into 5 categories, impact of COVID-19 on income into 5 categories. So we asked them whether they see any changes in their regular source of income, and the responses were captured into 5 categories, which is completely stopped, reduced a lot, reduced a little, no effect, increased, and don't know. So from our country-specific analysis and reports, we found that actually income is also related to countries' pre-COVID economic situation, the rate of infection, and also how the country is managing the infection of the COVID, for example, the lockdown or restriction situation. So if you can see in the slide, you will see that, for example, in Philippines, we see that as of July, mid-July, still about altogether 2% survey population, they reported that they have either facing a complete stop in their income or a lot of reduction in income. So 76% still have reported that they are facing a lot of reduction in income. So as we know that Philippines is one of the countries in South Asia which has a high number of COVID infection. As of August 20, I think they have reported around 68,000, almost 69,000 COVID cases. So as a result, the government of Philippines actually has imposed a lot of restriction, and community quarantine is still in place. So that might have some impact on their income. If you also look at the Sierra Leone and Liberia, those are the countries those actually already have very weak and fragile economic condition even before the pre-COVID situation. So they are also suffering a lot from this infection of COVID, particularly in terms of the low-income group and the people living in poverty. They are suffering a lot in terms of the income loss due to COVID infection. Next, please. Next slide, please, Sane. Hello, Sane. Can you go to the next slide? Sorry. Yeah, thank you. So in addition to the current status as of July, mid-July, we also tried to see whether there is any trend in terms of impact of COVID-19 on people's income, source of income. And this slide a little bit clumsy, sorry.
I think we have just lost the connection with Eliza, so we'll be working on getting her back for you as soon as possible. Apologies for that. As it looks like we're struggling to having Eliza's connection seems to have dropped. I was wondering if I could ask Munshi to comment on the impact and the findings from the research whilst we work on getting Eliza back on again. Is that okay, Munshi?
Hello? Hello? Luis, can you hear me?
Ah, hello, very good. So we've got you back.
Oh my God, I'm so sorry. I don't know what happened. I just lost the connection.
No
anyway.
worries. You're back now, so please.
Yes, I'm
carry
back.
on.
Yeah. Okay, sorry for that. So as I was saying that in this slide, we tried to capture some trend in terms of the impact of COVID-19 on people's regular income. And as you can see from the slide that there is a general tendency of percentage of population who reported a lot of reduction in income actually has increased from round 2 to round 1 to round 2. And then it has gradually decreased in round 3 and then remained more or less static. But except in case of Philippines, which is that this ash color or gray color line is, as you can see, that it actually has continued to increase. The percentage of population who reported to have a lot of reduction in income actually has increased from round 1 to round 3 and then has decreased slowly, but still it has around 82% population, survey population reported that they have either, their income has either completely stopped or they are facing a lot of reduction in income. Similarly, with Sierra Leone, which is this maroon line, is also facing a lot of reduction in income as of July 20, and in Sierra Leone, actually, it has gradually increased. But in other cases, usually it's increased and then declined gradually. Interestingly, as you can see from blue bar, which is Tanzania, in Tanzania, actually, the percentage of population who reported a lot of reduction in income, it was increased from round 1 to round 2, which is around mid-April, immediately after the outbreak of COVID-19. then it started gradually decreasing, and it has really decreased significantly as of mid-July. And the reason behind it may be because, as you know, that in Tanzania, actually government never has imposed really strict lockdown or the restriction, but in fact from April or I think in May, from April, government actually has re-emphasized to reopen everything and keep everything, economic activities open and resume economic activities as well as institutions, learning institutions. So that might be one reason. So you can clearly see some trend. Then we try to see how income, whether or not there has any differential impact in terms of the main source of income. And from this slide, as you can see, as Munshi Bhai was presented, that our participants, they were mainly dependent on these 4 types of main source of income. And from this slide, you can clearly see that people who rely on salaried income, they are in a better position than other sources of income. So, and then when you looked at among those other sources of income, people who are relying on daily wages or casual work, they are actually the most affected. As you can see, that round 4, which is as of mid-July, still 15% of them who are relying on casual work, they actually have lost their income completely. And also around another 49%, they reported that they have reduced, they're facing a lot of reduction in income. Also, which is important to note is that across all sectors, as I said, except salary, most of them, they are actually still facing a lot of reduction in income as of mid-July. Next. Thank you. Moving on to the effect of COVID-19 on food security status. So again, we looked at the food security status and we asked them whether they have seen or they are facing any changes in their food consumption. And we captured the responses into 5 categories. So as you can see from here, that reduced a lot, reduced a little, no change, increased, and don't know. So the red segment of the bar, it presents the reduced a lot. And from a general look, you can see that still across all 10 countries, a lot of population is facing a lot of reduction in food consumption, except Myanmar and Tanzania. So again, it's somehow related to their income status as well. So in terms of Philippines, if you can remember, the Philippines, the income status was very bad, and the people there is also facing a lot of reduction in food consumption. And it's also maybe because most of them, they are really relying on food purchase. And food, from our other data, we have found that there is a gradual increase in food price, and almost across all countries, a lot of people reported that they are spending more than usual on food expenditure because of price increase in food price. So similarly in Sierra Leone and Liberia, who were already facing a lot of food insecurity even in pre-COVID situation, they are facing a lot of food insecurity now, and they have reduced their consumption a lot. So as you can see, almost more than 1% reduced their consumption. Next. Hello. Hello. Next. Sunny.
Eliza, are you still with us? It seems that we have lost Eliza again. Let's give Eliza a chance to get reconnected. And in the meantime, I'd really like to move over to our regional directors for Africa and for Asia to discuss Eliza, if we could just, you back with us again?
Yeah, I am. Yeah, okay. Do you want me to continue or?
Yeah, if you could just briefly
Yeah, maybe I can
continue
finish
for
quickly,
a couple of minutes?
few
Yes,
more
thanks.
slides.
Yes, thank you.
Yeah, sure, sorry. I don't know. So yeah, we try to look at the whether there is any additional impact or differences between the impact in terms of food security between male-headed and female-headed households. And as you can see here, that female-headed households is actually, they are more vulnerable to food insecurity. As you can see in Uganda, the female-headed households is suffering, like they have almost 9 days less food secure than male-headed households, and we looked at the number of days they can sustain their food need based on their current food stock or the income that they can acquire food. Similarly, with so similarly in Rwanda, female-headed households actually have almost 12 days less food secure than the male-headed household. Next, Sunny. Sunny, can you go to next? Yeah, thank you. So quickly, we tried to see whether what type of households are more food insecure or vulnerable to food insecurity. We conducted some correlation and regression analysis. And here we actually considered the number of days they can secure the food based on the current food needs, and current food stock. And we found that, and try to see the relationship with different factors. And as you can see from this table that people, our microfinance clients are actually 3.5 more days food secure compared to non-microfinance clients. We also found that main source of income has some relationship with food security status. As you can see, that salaried employment, rely on salaried employment, was more 3.6 days more food secure than business category, which we considered as the base category. On the other hand, casual workers, actually they have like 3.4 days less food secured than the business category. Similarly, we said female-headed household, as I already said, that they are less food insecure than male-headed household. Next. So we also looked at some other aspects of impact of COVID on other aspects of life. And we asked them whether as a result of COVID, they see or heard about any increase in violence in the community. And it seems like in Afghanistan, Uganda, and South Sudan, the violence is an issue. As you can see from the graph, that it has actually a lot of people reported on community violence, which included theft, robbery, gender-based violence, or food insurgent type of violence. Next. So here, as you can see that a lot of people reported on domestic violence. They heard about domestic violence, and a small percentage also reported on gender-based violence. Next. So when the people who reported on gender-based violence, we tried to go into the deeper level and ask what sorts of gender-based violence they are observing or they have heard of. And as you can see here that a large number actually talked about domestic violence, and then followed by that another 35% actually talked about early marriage as a gender-based violence. A small percentage also mentioned rape as a gender-based violence. We wanted to see from the gender perspective whether there is any additional or special impact of COVID-19 on women. So we asked them that in your opinion, do you think that women are facing any additional challenges or difficulties as a result of COVID-19? And these are the responses we received from them. So as you can see from this pie chart that almost 36% they reported that it's female-headed households are facing additional reduction in income compared to male-headed households, and another like 18% and 19% reported that female are facing a lot of increased mental stress and also reduction in food consumption. It's mostly the female members of the household who are reducing the food consumption. Next. So we try to see what sorts of support they need, and as you can see from this graph that still as of July, mid-July, people are still wanting food items, support for food items, followed by healthcare, which is 35% asking for healthcare support, and also a large percentage is asking for cash transfer or financial services to regain their economic activities. Next. So then we try to see what sort of support they have access to or they already have received. And we found that it's only in Philippines, almost 100% they reported that they have received some sort of supports, but in other countries, the access to support is very limited. And in case of Rwanda, actually, the support actually has reduced from round 1 to round 4. I think that's all. Next. Okay, so what is the major takeaway? As we can see that food and income security status is actually continuing to be worsening, and women-headed households, they are more vulnerable to food insecurity and also income insecurity and also gender-based violence. Support are not adequate, and with the easing of lockdown, the economic activities have been slowly resuming, but it's still the impact, adverse effect of COVID is still very high, and there is a high demand for food and cash support. Thank you. I think that's all. Really sorry for the internet connection.
Thank you very much, Eliza. We got there in the end, and that was very interesting, and perhaps some surprising impacts of COVID during the last few months. So thank you very much for getting through there and getting the connection back again. So now turning over to the impact is particularly in Asia and how BRAC is responding in Asia. Can I now hand over to Sajedul, our Regional Director for Asia, to discuss how we're responding to the findings there. And if you could keep this quite quick, Sajedul, we're running a bit tight on time. Thank you.
Hello. Lois, you can hear me?
Yes, very well. Thank you.
Good. Okay, good. So I'm not actually using video. And sorry, actually calling for prayer is ongoing, so it will finish maybe in few seconds time. But I can actually continue my discussion. So I will be actually discussing a little bit about the COVID situation in the BRAC international countries and also our strategy assessment that actually presented is linked with our COVID response strategy. So just actually if I start remembering some of the information according to our record, that especially in Philippines, BRAC International, we are working in 10 countries. So in Philippines, actually the first case of COVID was detected in January, and then followed by another few cases in Afghanistan, and by April, most results actually from March, BRAC International starts still on, especially in the especially food consumption and income and other. That's actually is little higher than many other countries, and one of the reasons, considering all those things, actually Philippines actually is the highest number of positive cases, and the consumption and income is also challenging. As I said, that the BRAC COVID strategy, in March, we developed our COVID strategy for preparedness and response. So what are those? Number one is the safety and safeguarding of all staff. Since actually BRAC staff was actually engaged in responding to the COVID, so we ensured that all staff actually, they actually have been trained on COVID prevention, mitigation measures and other. And so all staff, actually they received training on COVID awareness and mitigation measures. Then of course the other one, since actually we worked with the community, that was actually community awareness raising and infection prevention control activity promotion. That was actually another strategic pillar of BRAC, and we responded and we reached hundreds of people with awareness messages, sensitization activities, all those things. And then actually the other thing, actually the important thing is the partnership in managing context-specific outbreak, because that's also actually important for BRAC, because BRAC alone actually cannot work. So we actually collaborated with UN organizations, with international NGOs, local NGOs, civil society organizations, community groups, and most importantly with the government. So whatever actually we have accomplished, that was actually a joint collaboration with our partners. And then the last but not the most important actually pillar of our strategy, which is food security, social and economic recovery. That actually we have just discussed. Eliza and Munshi bhai, they have actually presented the findings from those things. So one actually is the assessment. Based on the findings, BRAC actually is responding to those areas: food security, social and economic recovery. That process actually is continuing. Data and information gathered through our food and income security assessment, helping us to understand the food security, social and economic situation in each of the BRAC international countries. From the presentation that we have just learned that main source of income is completely stopped or reduced, and reduction of food consumption for a good percentage of families in the BRAC international countries. So as a result, actually, BRAC has taken some initiatives to maintain food security of the poor and vulnerable families. We are exploring funds to address the food security issues in the countries. BRAC actually has its own initiatives. Also, we are exploring funds. And BRAC is also sharing the assessment findings with the host government, UN organizations, donors, and other stakeholders.
Sajedul,
yes.
Thank you very much. I think we're going to have to move on to Ruth now, as we're running a bit tight on time.
Okay, thank you.
Thank you very much for highlighting how you're using the findings in Asia. Much appreciated. Okay, Ruth, so the African situation, how have you been using this important research to inform our programming in Africa?
Thank you very much, Liz, for this opportunity, and thank you to all the other speakers. In the interest of time, I will not go into real details because my colleagues have mentioned quite a number of things, but let me address two ways in which we've attempted to address the issue of the results of the rapid assessment, mainly on the issues of reduced income and therefore by extension reduced food consumption. From one of the findings was the business community have suffered most, and this is really our usual small entrepreneurs that we give loans to as BRAC, under our microfinance scheme, that because of that, we did not stop giving loans, but we closed. So in essence, we did stop giving loans. We closed our operations, and therefore even the businesses closed because most of the countries were closed. So what we did as BRAC is we gave them opportunity for rescheduling of the loan repayment. We rescheduled the loan repayment so that they had a loan, a repayment holiday. They didn't have to repay the loans immediately, but we gave them about 2 months that they could see how best they can get back into business and repay the loans. Again, at the start, we tried to give loans when we came back to only our existing clients, but we realized also that there could be other people who have suffered losses in their business and needed to come up. So we decided to open up this space and give loans to everybody who wanted to have loan and met our criteria as a way of revamping the economy and also bringing up our clients and in a sense improving on food security and consumption at the household level. So our approach from the business perspective is let us give a holiday, let us reschedule the loan so that we don't put pressure on anybody, let us give new loans to people who qualify, and at the same time we also see how we work on a digital platform so that in future people who want to repay loan, people who want to take loan can be able to do that without any delay, because that was a learning from us that things could have continued if we were on a digital platform. So we are now piloting a digital platform where we can work on loan repayment or people taking loan on that platform. The second aspect that we learned from this is, reduction in food. Obviously, yes, it is true. And most of our countries rely on agriculture. And we realized that we need therefore going forward to really push on the agricultural production, food production, diversify crops, and also support with the tools that would enhance production. Again, the countries that have relied more on food imports, particularly like a country like Liberia, despite having a very good weather, very good soils, fertile soils, for a very long time they rely on food imports from different countries. Now, our approach is we must ensure that production is at the country level. We are not going to, encourage importation of food. Well, at our small level, we are going to encourage our communities to work to produce that food. And we've started that. If you go to our Liberia program, for now, we partnered with different organizations to encourage food production, to scale up that, and also to ensure that we work on market access, where they produce surplus, they can already begin to sell to different stakeholders. In the interest of time, Louise, I'll stop there and just say that, yes, we are taking the rapid assessment very seriously, and each aspect that has come out, we are mitigating on it as BRAC. Thank you.
Ruth, thank you very much. It sounds impressive, the actions that your team in Africa are taking. If anyone has any questions, please post them now in the chat box. Haven't seen any questions so far, so perhaps I'll take one of my own and have the opportunity as the moderator here to ask a question. Ruth, in particular, how do you see the capacity of humanitarian organizations to mitigate the impacts of the crisis for the most vulnerable, particularly the major players like WFP and others? What was the capacity situation like? Perhaps you can comment on that. Thank you.
Yeah, thank you very much, Luis. As we all know that this pandemic is global, and the impact has ravaged all the countries more or less at equal level. But I would say the sub-Saharan African countries was already fragile. If you look at sub-Saharan Africa, even before COVID, the countries are already in a very fragile state. And this has gotten to a worse position. So the other organizations like WFP should really come strong to support communities that need actual living from where they are. Particularly from the report, we see that many of the households are very food insecure. From the first assessment in April to the last assessment that we had in July, there's been drastic number in consumption of food. You look at the communities, the beneficiaries reporting that they've really reduced in their daily intake of food. This is not something good, because the net effect is we are slowly going to have very malnourished children, and therefore even very malnourished mothers, particularly expectant mothers, and therefore we are sitting on something I would call a time bomb. If we do an assessment in another couple of months, we will see, a high level of malnutrition, high level of expectant mothers that are also malnourished. In essence, that would mean that we will be having, a bigger issue to deal with, which we can now come forward and mitigate by giving food support to communities that need it. This can be done through government or through local and international organizations that operate in those countries that are already working with the vulnerable communities. Thank you, Luis.
Thank you very much, Ruth. Not having had any other questions from the chat box, perhaps I could just ask another question to Munshi, please. We noticed that many of the participants in the survey were urban-based, but did you notice any particular differences between rural and urban from the assessments, and what were the most significant differences in terms of food security? That's to Munshi, and perhaps Eliza might want to comment as well. Thank you.
Sure, yeah. Actually, typically poverty is associated with ruralness, but COVID has sort of switched the things a little bit. So we do see a trend whereby the day laborer, mostly casual day laborer who primarily live in urban areas, they were sort of immediately hit by the sort of more strict lockdown back in March, April, up until May, a bit of June as well. Whereas in the rural areas, things were a little bit, in terms of access to food, were relatively better than urban areas. But then things have sort of opened up differently in different countries. And in the more recent one, in the fourth round, I think there is a big heterogeneity differences across the different countries. So, for example, by July, there was harvest in rural areas for Uganda, Tanzania, so they have sort of higher food stock. Whereas Myanmar, they had their harvest earlier, and then the sort of harvest is depleting, and they're facing the problem of transport lockdown. The transport costs going up, that sort of limited the price. The rural-urban price beyond the data, but we know from sort of different sources that the price differences were getting higher. So I think, I mean, as Ruth said, I know everyone is kind of affected one way or another, but it was kind of interesting that rural areas in terms of food were doing a little bit better, or partly because they also rely mostly on own production. But things are different now.
Thank you very much, Munshi. Very interesting analysis there. We've had one question here in the chat box, which is can you please give any information on how donors are reacting to the plea for fund? Perhaps I can direct that question to Sajedul, please. How are donors reacting to fundraising for the COVID response? Thank you.
Okay, thank you, Louis. So yes, especially the assessment reports, we see that donors actually, they have much interest on this thing, and depending on that, in some countries, we have actually mobilized some fund. So country like Afghanistan, where actually we have actually mobilized fund for different activities, starting from some livelihood activities, education activities. And if I say that the donors, I see that yes, livelihood is important, but in many cases, donors actually, they are expressing interest on the education program. So that is actually the situation in the Asia region. And also some of the donors, they came to us, and we are actually submitting some concept paper. Hopefully, actually, we see the result soon. Over.
Excuse me, I was muted. Thank you very much, Munshi. We have one more question in the chat box here. And I think this should be directed to Munshi again, because it's about the research methods in particular, and is two parts to this question. Is sample sizes are rather small, therefore standard deviations will be high, and secondly, the need to view COVID in the context of other shocks. Was this done? When did we find that COVID was one of several shocks and not the most important in many cases? So perhaps Munshi, you could talk about the sample size, and then Eliza could weigh in as well. Thank you.
Right. Yeah. So on sample size, it's true. In the round one, where we had around sort of 100 observation per country, the margin of error is much higher. But in the fourth round, where we have around 400 observations per country, the margin of error is actually within the sort of acceptable 5% level. A couple of clarification there. One is, when you calculate the margin of error, it's sort of, it's taken as standard 5%, 90% confidence interval, etc. But that doesn't necessarily account for the issue of who are we talking about, this population, the selection. So as I will sort of reiterate the point that this comes from the database of beneficiary and volunteers that we have in our records. So this is reflective of them, and with that 5% acceptable sort of margin of error, which is not unusual. The second aspect is not all the countries have the same number of observations. So Philippines, we have around 50. So obviously the margin of error is way higher. But despite all of this, when you see a sort of comparable trend across the 4 rounds, which we see, it's kind of, it's not necessarily sort of measurement error as such. On the issue of how, second question was related to, I can see one question about income effect be income affection measured? Sorry, Luis, could you repeat that one? And
yes, it's in the chat box there from Neil Marshland. It's the sort of view, it's the impact of COVID in the context of other shocks. So
right, yeah.
how did you differentiate the impact of COVID from other impacts in household level or regionally?
Yeah.
Thank you. Yeah.
Yeah, absolutely. Yes. I mean, yeah. So these are questions we are directing to the respondent, saying, due to COVID, did you have a loss of income? And that's sort of, in the explanation, it's because of COVID, mostly the lockdown measures related to COVID. But you're absolutely right. We don't have a counterfactual of, for example, in Uganda, there's this the major crisis around the Victoria water level being the highest in the history, or the locust infection in East Africa in general. So we cannot distinguish between these sort of ongoing other covariate shocks and COVID, but we ask them as to respond to COVID shocks, what they have faced. So that's another sort of limitation, and that's kind of not unique for us. And the other thing to remember is, there will be sort of thousands of papers written as being done on the sort of how this shock has affected our lives. But at this point, I think, in this rapid assessment, we're not sort of too concerned about trying to sort of disentangle these different effects. People live with COVID and everything else. Good.
Thank you very much, Munshi. We've actually come to the end of our allotted time. We're in fact a little bit over. So I'm going to draw the webinar to a close now, but I can see there are some other questions coming in. So we will absolutely forward those to a relevant person. And if you have any other questions, you'll see on the screen now that there is an email address, info@bracinternational.nl. Please do email us if you'd like any more information or you have any more questions about the research. And please do download all the assessment reports of ACT are on the link that you can see on your screen, COVID-19@bracinternational.nl. All of the assessment reports available, including the one we've just discussed here, the very latest, as well as information about BRAC strategy and situation reports, regular situation reports from all of our countries. Thank you all very much for joining us today for this webinar. Very much appreciated. Thank you for taking the time to join us today. Apologies again for some of the connection problems. We have colleagues joining us from all over the world, so it's been a little bit tricky, but thank you for bearing with us. And please do read the detailed assessment reports and information there, and contact us via the email address if you have any more questions. We will be circulating the recording of the webinar as well shortly to all the participants. So thank you again very much. Thank you also to our participants, our panelists, Ruth, Sajedul, Munshi, and Eliza. Very much appreciated. Thank you for your time. Much appreciated. Thank you and goodbye.